The project to build a new infectious disease clinic at Fann Hospital is of great significance to Professor Moussa Seydi. For the past 6 years, he has been diligently seeking and raising funds to achieve this project. I must also mention that he initially secured a portion of these funds from an American foundation, which typically does not support infrastructure projects of this kind in sub-Saharan Africa. Professor Seydi was able to secure an exception due to his leadership and interpersonal skills. Also, in early March, when the COVID-19 pandemic struck, the head of state established a COVID fund to combat the pandemic. This fund fully financed the construction of this state-of-art tropical infectious disease clinic. I was very impressed by Professor Seydi's dedication to establishing these facilities, for which he fought very hard. That's why I'm delighted to inaugurate this facility at the end of December. The center, which will provide us with a modern facility that meets all current international standards for treating infectious diseases.
This is the dream of a man who wants to see improvement in his patient's daily life, to see research progress, and more health projects to take off in Senegal. All this summarize the project for this new infectious and tropical disease department at Fann Hospital in Dakar, led by Professor Seydi. The initiative took shape when Senegal, like the rest of the world, was severely facing an unprecedented COVID-19 health crisis.
Professor Seydi is a very committed man. He is very dedicated to what he does, and he is also persuasive. And anyone who listens to him talk about this project is first of all seduced and impressed by the quality of the infrastructure he wanted to put in place. Also, you want to be part of this great patriotic adventure because the project at the end to set up an infectious diseases clinic exists only in Senegal and nowhere else in Africa. This also explains why the head of state has mobilized billions and great financial resources to put it at his disposal to help him to fulfill his dream. That's why I can tell you also that this is one of the things in his life that he's most proud of. So that's why he's usually so full of thanks to the head of state. And that's why I'm pleased to see that national professionals are fighting with dedication and selflessness to secure funding to provide the best health standards for patients. We needed to establish a center capable of admitting all patients regardless of their social status. This center will enable us to take a significant step towards economic development in Senegal. All our infrastructures, whether in health or other sectors, must meet the highest standards. That's why including hospitals on this investment plan, we have ensure our health facilities are brought up to standards.
After the Gilead Foundation, the Senegalese government became the second institution to support the initiative.
First and foremost is a feeling of satisfaction and pride. In all the policies I pursue, my goal is always for Senegal to be at the highest level in terms of standards. When I have established a Senegal Airlines, I aimed for the state-of-the-art aircraft. The most recent train we built is also a latest generation model. That's why, in this case, I also encourage Professor Seydi to make this new clinic a health center of international repute. I'm pleased to see that national professionals, through their altruism, have been able to secure funding. They have fought to ensure that patients receive care in the best possible conditions, and building a health center that can hospitalize all kinds of patients regardless of their social status is essential, and this center will make that possible.
The global cost of the Infectious and Tropical Disease Department is around 4 billion francs CFA. 1 billion is donated by the Gilead Foundation. The remaining come from the support of the Senegalese government and the contribution of the Islamic Bank. This new building is a symbol of a gentle revolution, creating a wonderful synergy between cutting-edge technology and patient comfort, but also fosters an optimal research environment. For almost 20 years, Professor Moussa Seydi's silhouette has become very familiar to hundreds of patients who are being treated for different pathologies. We must say that if the medical doctor Professor Seydi is an emblematic figure in research for many researchers and young doctorates in Senegal, in Africa, and in the rest of the world, he looks even better walking down the aisle of the new Infectious and Tropical Disease Clinic with his team. The new department is in fact one of the best reference health centers in Africa and even in Europe. It is equipped with 72 fully equipped patient rooms, medical fluids rooms including 13 suites, 5 hospitalization rooms, and 5 rooms in a critical care unit with negative pressure. This last one, the intensive care unit, is well equipped with intelligent beds. It also has latest respiratory generation and the best ventilating technologies for COVID-19 patients and those requiring non-invasive or invasive ventilation. The department has 2 negative pressure rooms and a mobile X-ray unit as well. It is a consecration of cardinal values that the man wears for his team. We are very proud for this new infectious disease building, which is the reward of a job well done. Our team is indeed led by Professor Seydi, a boss who takes us under his wings. He is also an exemplary boss. He is like a big brother to the team. He shows us what we have to do to keep up a good job. Professor Seydi likes a job well done. He is punctual, rigorous, and respectful for the whole team. He is also a very dedicated person who loves his patient. The whole country can testify about that. He knows how to work with discipline and respect. The way Professor Seydi managed the COVID-19 health crisis in Senegal made us really understood the person. But he has always been like that, rigorous in his work, respectful of his patient and his colleague. We will therefore continue to follow his footsteps. We wish him really well with this project and wish that the entire team will be able to settle in the new building, be able to continue to carry out research, prevention, but also to continue improving healthcare in Senegal. Professor Seydi truly deserved this infrastructure for which he fought with hard work. The new Infectious and Tropical Disease Department is built with the highest standards and a secure environment. The new infrastructure is equipped with a video surveillance and a crowd control system using codes and fingerprints. It has also 2 electrical generators that operate in redundancy as well as batteries in the event of a power cut. Equipment also includes organized oxygen plants, which provide 3 levels of security in accordance with international standards. In this service, people with reduced mobility as well as social cases have been taken into account at all levels. The Health and Social Ministry has expressed his satisfaction.
The first question I asked Professor Seydi was about the cost, and when he told me the amount, I replied, "You were able to accomplish all this with such modest budget? That is truly remarkable. This shows that in our country, we can achieve great things with limited resources. What matters most is the will to succeed and a commitment to productivity. When we look at what he has accomplished, we must acknowledge that it has been done for future generations who will be fortunate to be trained here with state-of-the-art equipment. The Ministry of Health should also benefit from this achievement, because this center will play a crucial role in responding to future epidemics, as it already has the necessary equipment. Our vision is to see how Professor Seydi can replicate this model in other parts of Senegal." Both of them passed their competitive examination for aggregation, with one achieving the top position and the other coming in second.
In designing this marvelous health department, the conceptor's aim was to improve medical research and take it to the next level. This has been achieved because the department now houses 3 laboratories, and icing on the cake, it has a polyvalent amphitheater. Professor Seydi is a member of the National Academy for Science and Technology in Senegal. He is the chairman of the Senegal Antibiotic Committee. He is also an associate professor at the University of Washington and a member of the External Advisory Board for Innovation in Point-of-Care Technology for HIV AIDS at Chicago University. Professor Seydi, the exceptional shareholder of Infectious Disease at the Faculty of Medicine, Pharmacy and Odontology at Sheikh Anta Diop University in Dakar, has not forgotten his vocation as a researcher. He also intends to finalize the creation of the eHero Foundation if Senegalese authorities are willing to help him. The foundation mission is mainly to ensure the maintenance of the facility, but also to develop more research and infectiology teaching.
He has demonstrated his commitment to support us through the Hero Foundation, not Hero as in champion in French, but Hero, which stands for Health and Research Organization. I would like to express my sincere gratitude to him. I encourage you to continue with the Hero Foundation and to make it a valuable tool for Fann Hospital, the university, and all of Senegal.
Professor Seydi is the leader of over 30 research projects, among others the University of Washington in Seattle, the Northwestern University in Chicago, the Johns Hopkins Hospital in Maryland, Baltimore, the Burns University in Switzerland, and the Pasteur Institute in Dakar, and the IRESSF. But from now on, we can also add to his resume the title of a real estate developer for cutting-edge medical infrastructure. Professor Moussa Seydi indeed has a reputation to always think big, very big.
In the long run, we aim to provide accommodation for the caregivers of our patients, At the infectious disease department, we have a garden to create a more welcoming environment for our patients. It will be ideal to relocate that garden here along with other facilities, but the priority was to build this center. And we must keep moving forward, because if we do not progress, we risk falling behind.